Preparedness is not just about the next headline of an outbreak, but it's about building reliable systems that are sustainable to help us in containing outbreaks. And at CGP, we are the forefront of actually harnessing data and turning this data into evidence-based decision making that will save lives. I am Dr. Mark Nanyingi, the Public Health and Infectious Diseases Epidemiologist, and currently the Technical Director for Global Health Security at the Center for Global Health and Pandemic Intelligence. CGP is a multidisciplinary consortium that brings together to harness science and data and brings in the community involvement and resilience to enhance global health security. We have technical areas of focus, and the main ones will include One Health and antimicrobial resistance, but we're also very keen on epidemic and pandemic intelligence. We work across disciplines on digital health and artificial intelligence. One Health at the crossroads and the interface of the human, animal, and environmental interface provides us an opportunity for epidemic and pandemic intelligence, whereby it strengthens our preparedness and response mechanisms. And we call upon researchers, partners, your policymakers, or in practice across the world to join us as we are focused on scaling up evidence-based tools that will be very critical in actually helping us to contain, but also to prevent emerging and re-emerging infectious diseases that have pandemic potential in the near future. CGP is at the forefront of supporting countries in pandemic preparedness and response mechanisms by working very closely, for example, with the Kenyan government under the Kenya National Public Health Institute, working closely with the African CDC, the WHOAFRO, the African CDC, also the AU-IBAR. I think the focus is actually trying to create mechanisms or frameworks of collaboration, tapping into existing resources, for example, from the Pandemic Fund, the World Bank, to build resilience mechanisms on how countries or regions or communities at large will be responding better to the pandemics that are actually engulfing some of these regions. Has a number of flagship initiatives that is working very closely with governments. For example, in Kenya, we are working with the National Public Health Institute. And one of the initiatives that we are championing is what we call the decision-making tool for public health emergencies, the DMT. And this is a tool that will just fasten detection, notification, and response following the 717 framework. And it's built for subnational level, whereby you'll save time in terms of decision making on how, when, and who responds to disease outbreaks in near real time to save resources. But also we have EWIN, which is the Epidemic Intelligence Network, and this actually involves incorporation and digitalization, whereby we are using artificial intelligence to actually flag out areas of risk where layers, geographical layers, environmental aspects, all those are brought together with the population aspects actually to show us areas that have highest risk of disease outbreak. But another thing that we are focused on is the One Health Sentinel network, whereby we are looking at the community involvement in building community One Health units across points of entry in the high-risk areas that are prone actually to emergence of infectious diseases. So the decision-making tool, just for emphasis, is that it's going to help in terms of faster detection, rapid notification to authorities that are making decisions, and then escalate mechanisms of how prudent use of resources to mount response mechanisms all the way from the subnational level, that is the county or the sub-county level, up to the national level. By doing this, we will be eliminating the time lost and also the resources that are utilized by consolidating these resources and using them effectively, so that in future we might have reliable mechanisms of how and when to respond with clear roles and also the clear pathways of notification all the way from local mechanisms up to the international level, including reporting to the World Health Organization or the World Animal Health in terms of the cross-cutting issues between animal health and human health.